Chairwoman Davis, Representative Wu, I thank you all for the opportunity to testify today. My name is Will Francis, and I'm the Government Relations Director for the National Association of Social Workers Texas chapter. I wanted to talk about work requirements, and I think you did a fantastic job of explaining how and why those would not really fit with our current Medicaid population in Texas. I don't want to necessarily harp on that, but I do want to at least talk about some of the concerns around that area, both from the perspective of if Texas were to expand Medicaid, what that would look like, and the idea that I think that there's a whole lot of people out there who don't really understand either who Medicaid does cover or what work requirements would look like. And, just to preface everything, I think it's important to understand, or at least I would like to say, that Medicaid is not welfare, it is health care. And so this idea that we are sort of asking people, especially those who potentially can work, is what, from our perspective, what we think they can work, to simply do that, to receive health care, I think is a rather misguided way of essentially approaching the problem. And so, in regards to that, I'd just like to cite a few stats. Of the roughly 25 million people nationally who could be subject to work requirements, 60% are already working and 79% have at least one worker in the family. So this idea that sort of they are out there getting health care without working, I don't think plays out as well. Nationally, studies estimate that about 1/3 of all non-working, non-elderly adult Medicaid enrollees not receiving SSI report that they are unable to work due to a disability, which again covers a large portion of the Texas Medicaid population. Enrollees may lose or see interruption in coverage because their work hours fluctuate from month to month, sometimes falling below required thresholds. Fluctuating hours are particularly common in the two industries with the largest number of Medicaid enrollees, restaurant or food services, and construction. Again, I know you know these, but I think it's important to understand and to see who exactly would be affected. About 36% of Medicaid eligible low-income people with any mental illness, and 40% of those with a serious mental illness do not work. And only a minority of 60 to 64-year-old Americans work. In addition, some working enrollees of all ages work part-time, meaning they might not meet the eligibility requirements. And I think there was some good discussion earlier about the fact that, especially from Ann Dunkelberg, about how those who potentially would work would maybe then bump out of eligibility. And I think, again, that's a larger concern. And then lastly, again, I think all of this does come back to the fact that Texas has lost out by not expanding Medicaid. Whatever the philosophical reasons behind that are, those are dollars that we left off the table. And from the expansion perspective, I'd just like to cite a few statistics, which is that overall expansion reduced unpaid medical debt in its first 2 years by $3.4 billion, which has resulted in a reduction of financial stress on individuals and institutions. Hospitals in rural states where resources are specifically limited, saw an increase in patients covered by Medicaid and a corresponding decrease in uncompensated care, which improved hospitals' overall bottom lines. Medicaid expansions have reduced violent crime by 5.8% and property crime by 3%, and the ACA's Medicaid expansions resulted in cost savings of $13.6 billion due to the reduction in crime, and that each additional substance abuse treatment facility in a county reduces the social cost of crime in that county by $4.2 million a year. And additional annual cost of treatment in a facility are approximated at $1.1 million. So overall, I think that there's a lot of decisions Texas is going to get to make. I understand how challenging the decisions you all have had to make around the budget for Medicaid are. I understand it's become a huge cost factor of the budget, but I think that overall there are ways that we want to keep this program so that it is open to all who are eligible for it, and that it does provide health care for some of our neediest and the Texans who really could utilize it the most. So thank you for the opportunity to testify today.
Thank you for your testimony, and I think it's always important to make sure that everybody, as best as we can, understand who exactly is the Medicaid, who are the Medicaid recipients in the state of Texas, because I have found oftentimes people really do not understand, and they think anyone is just eligible. But when you kind of get in to know, who are really talking up, people's perceptions start to change a little bit about the program. So thank you very much for your testimony again.